Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Pelvic inflammatory disease. Pelvic inflammatory disease. Here, infection of upper genital tract is called as pelvic inflammatory disease. It includes the infection of fallopian tube called as salpingitis, infection of ovary called as oophorytis, infection of uterus called as endometritis, infection of peritoneum called as peritonitis, cervicitis and vaginitis are not involved in pelvic inflammatory disease. Causes of pelvic inflammatory disease. Polymicrobial infection is important in pelvic inflammatory disease. The most common organism involved in pelvic inflammatory disease is chlamydia, followed by gonorrhea. The most common cause in acute pelvic inflammatory disease is gonorrhea. The most common cause in virgin females is genital tuberculosis. The most common cause in inflammatory the most common cause in intrauterine contraceptive device users is actinomyces. Pap smear cannot detect chlamydia and gonorrhea. On pap smear, actinomyces can be recognized as it is larger than the size of squamous cells. The most common route of spread for pelvic inflammatory disease is ascending infections with the sperm, that is sexually transmitted diseases, except one which is genital tuberculosis is a pelvic inflammatory disease which is showing a hematogenous spread.
So all of these are ascending infections except genital tuberculosis, which shows hematogenous spread.
thank you and thank you for watching.